Hey, I'm Dan, the training guy over here at Loxo with a quick look at the Health tab in Loxo Source. It's a fabulous new enhancement that we've added in Loxo Source that's going to make your life a lot easier when you are sourcing healthcare professionals for an open role. All right, let's jump into Loxo and let's take a look at it. So when you're logged into your Loxo account, it defaults to the People tab when you log in, as you know, and to get into Loxo Source, you'll use this button up here at the upper right to click into Loxo Source, our global database of 1.2 billion candidates. And over here on the left is the new Health tab. As you can see, I'm pointing to it here. Now, keep in mind, it is in beta, so we are tweaking it and enhancing it as we go. So we're looking for your feedback over at support as you use this tool. But when I click on the Health tab, it immediately shrinks it down to 9.7 million healthcare professionals. Now, you can think of the Health tab as a subset of candidates found within the wider Loxo source database of 1.2 billion candidates. And so here we're looking at the 9.7 million healthcare professionals found within the Health tab. Now, some people have asked me, Dan, why should I use the Health tab if all of these people are in Loxo source? Shouldn't I just use the Boolean search bar up here and find them that way? You could, but the special sauce, as the kids say, is the fact that the Health tab has healthcare specific filtering. So, for example, their specializations, their license number, their certifications, and the facility that they're at. So, there are filters in the Health tab that are specific for healthcare professionals, which will help you fine tune your results a little bit easier to make your life a little bit easier. So let's do an example search here from this 9.7 million people who are healthcare professionals. Let's say I'm looking for, let's say, a pediatric nurse in the San Francisco area. They've got to have a lot of experience, hopefully 10 years or more of experience. And it would be nice if they have experience at the UCSF medical teaching facility, right? So that's a pretty narrow scope of a kind of a candidate we're looking for. So we can begin the search at the job title field in the healthcare professional tab. And when I go there and I start typing in pediatric, it's going to start showing me a lot of variations, right? Like pediatrics physician, pediatric emergency medicine, pediatric nurse practitioner. That's exactly what I'm looking for. I'm looking for a pediatric nurse in San Francisco with a lot of experience, and hopefully they come from UCSF. So I'm going to click on pediatric nurse practitioner, and that's going to narrow down this list of 9.7 million healthcare professionals to the 1,234 pediatric nurses in the healthcare tab. Now notice the moment that you start to use the job title filter, it starts to suggest some additional variations. So if I'm looking for a pediatric cardiology nurse or an advanced neonatal nurse practitioner or all these other variations that are available to me, I could immediately begin to filter further from the job title. But let's just say that I'm looking for a pediatric nurse, period. I don't need a cardiology specialist, a pediatric nurse example, right? So now I would be inclined to go straight to location next. I'm looking for a pediatric nurse that's in San Francisco. So I go to location and I start to type in San Francisco. And you see I've got San Francisco Bay Area. If I type in the full name San Francisco, we've got San Francisco Bay Area, San Francisco, California, sort of the city limits, and then all these other variations like San Francisco in Costa Rica, etc. Right? So I'm going to choose the wider San Francisco Bay Area so that we don't narrow it down too much. We want to be able to set that net at a wider sort of area so we can pull in people from the San Francisco Bay Area and not just people that are in the San Francisco city limits kind of thing, right? So I'm going to choose San Francisco Bay Area, and that now shrinks it down to 43 pediatric nurses who are in the San Francisco Bay Area. So we're getting close. And now I can go to something like years of experience. I think they said that they wanted someone with a lot of experience in our example. So I'm going to go to years of experience. And as you know, you can set it at less than 1 year, 1 to 2 years, 3 to 5, 6 to 10. I'll choose more than 10 years. We need someone with as much experience as possible for this particular open role that I'm working. So I'm going to choose that. And that's going to shrink it down from 43 to the 32 pediatric nurses in the San Francisco Bay Area that have more than 10 years experience. And now I can go to something like facility, again, a filter that's specific to this health tab. And I'm looking for someone that hopefully has experience over at the UCSF, University of California, San Francisco Teaching Hospital. Maybe that's something that the client is really looking for, someone that might have experience there in particular. Okay, so I'll type in UCSF and you can see, or I just type in UC and it starts to show me all the variations on facilities with nurses at something that begins with UC. So I'll choose UCSF Medical Center, exactly the facility I'm looking for. And that's going to shrink it down to 4. So now I think we're done. We have now found a tight list of 4 pediatric nurses in the San Francisco Bay Area with at least 10 years experience who have some experience in some fashion at UCSF Medical Facility, right? So now we've got Lily and Kalia and Zoe and Kimberly here. And just like when you're using Source generally, you can use the Show More button to see their full work history as well as their academic highlights. You'll be able to see where they're working right now. Lily is working at UCSF, right? So she's at that facility I'm looking for. And so we're in business now with this candidate. And you'll do the same in terms of vetting or examining the background on all of these nurses here in this list. And you've got the find contact information button here too at the upper right for when needed. If you are pulling in candidates where we don't have their contact information yet, you'll see the find contact info button here. So for Lily, I'm going to click on that and let our Loxo AI bots look for some contact information for Lily here. And usually within a couple of seconds, you're going to have an email address or a cell phone number of some sort so you can actually reach out to this person. You can also use the select all button up here to basically grab all 4 of these nurses, basically highlight all 4 of these nurses in these results. And then the action buttons will be up here at the upper right. The add to button is where you could drop all 4 of these nurses into that job in your jobs tab that you want to source them for, and they will drop right into the shortlist column of that job pipeline. You could also drop them into an outreach campaign from here and trigger that campaign to start looking to basically communicate with these nurses and get them excited about applying for that open role. Or you could drop them into a list, which is basically a folder in your people tab. So maybe you're putting together a folder of San Francisco pediatric nurse superstars, and you want to put these people in that folder for future reference, right? So those are the action items available to you. Under the 3-dot button to the left of the Add To button, you also have the ability to use Loxo Connect, our AI bots looking for contact information, to bulk enrich these 4 profiles. Now let's return to Lily. I use Loxo Connect to look for some contact info, and it looks like they found something. So now I see an email icon. When I click on it, I can see that I found her work email address at UCSF, and I also found her work cell phone number or work telephone number. So I've got a phone number and an email now to reach out and engage Lily here and talk to her about this job and get her to apply. So when it comes to Loxo Connect, you can use the find contact information button one by one as needed as you evaluate candidates, or you can simply highlight everybody in that list and have the AI bots bulk enrich these profiles with email addresses and cell phone numbers. So I think the key to getting used to using the healthcare tab is to run some practice searches. Pull up, a list of, 3 or 4 or 5 different healthcare professional roles that you are currently looking for candidates. And I would recommend start with the job title field and start to narrow it down and find the group of candidates, and then maybe go to location, years of experience, some of these other filters that might help you narrow it down appropriately, and then start to work with those candidates. I think the more that you practice searches in the healthcare tab, the more you'll get used to sort of the options available to you when you're, for example, searching job title and also searching by specialization or facility that they're at, this kind of thing. So it's not rocket science, but do reach out to us at support if you need some additional assistance as you're using the health tab And I want to reemphasize that this tool is in beta. So it's being developed and enhanced and tweaked, so to speak, by our engineers to make it as easy for you to use as possible. But if you have feedback, if you are seeing any weirdness, reach out to the support team and chat with us. So now, after you grab some candidates and you drop them into a job, for example, or you put them into a list or you add them into a campaign, you can go to the bottom on the left side and reset all the filters and basically begin your second search of the day. Now remember, it's going to default back to the public tab, i.e. the wider database and source of 1.2 billion candidates. So if you're doing another healthcare professional role, you're going to want to pivot to the health tab first and then start to apply filters to get down to that list of candidates you're looking for. Now, when you're done using source in this way, click out of it at the upper left, and just like you're used to, anytime that you do something with some candidates in Loxo source, we're going to automatically copy them into your database of people over here in the people tab, because we know you want to do something with those candidates to the extent that you highlighted them back in Loxo source. We automatically add them into your database here in people. All right, that's the health tab. I think you can see if you source healthcare professionals, this is going to be a very powerful tool to have in your back pocket. But use the chat button down here at the lower left, the question mark button, to chat us up at support if you have questions about the health tab as you're using it. And again, if you have any feedback that you'd like to give us that we can pass on to the engineers as they continue to develop and enhance this tool within our platform. All right, thanks for taking the time out to watch this quick overview of the health tab in Loxo Source.